Today we continue our series on the 3 most common standardized test questions I get from parents, taking on the second question: when should my child start prepping? At Zara Tutoring, we found that 11 weekly sessions is the sweet spot for being able to cover our curriculum with the students, honing in on the areas they have deficiencies based on the results from our SAT, ACT diagnostic, for students to implement the strategies we teach them on enough practices that they become second nature, and for students to get to apply the strategies they practiced for 7 weeks straight in our abbreviated practices to the full section practices and full practice test they do in weeks 8 and 9 respectively. While still having 2 more weeks before the test, we can provide further instruction on the areas they still struggled with on their practice test. Now, for some reason, I'm seeing parents deciding to do our 11-week program but hold off on taking the SAT for 3 or 4 months because the student doesn't feel ready just yet. I don't recommend that. I equate this to a professional athlete training intensely for the Olympics and then deciding to go on a 3 to 4 month hiatus, throwing on their running shoes the day of the Olympics and seeing if their body is still just as ready as it was during their focused training. We always have our 11-week programs finish the week prior to the test date, so students get in their last week of practices, rest the day before the test, and crush it on the day of the test. Stay tuned for our final installment of this 3-part series where we'll answer the question on how many times to take the SAT or ACT. And remember, you got this.